chairman of the board. Let me ask the directors to, if you would do a roll, Marcin, for the directors present.
Yes, Mr. Chair. Charles Klippel, Chair.
Yes, here.
Paul Philpott, Vice Chair.
Here.
CC Woods. Thomas McNeil. Grant Ritter.
Here.
Dietrich Gifford.
Here.
Thank you, Dr. Gifford. Steven Hernandez. Matthew Brackman.
Present.
Thank you. Andrea Barton Reeves, DSS Commissioner.
I'm here. I'm in the car, but I'm here.
Okay, thank you. Claudia Golds here on behalf of Secretary Jeffrey Beckham from OPM.
Here.
Thank you. Tiro Dolittle, OHA.
Here.
Caroline Zambetti on behalf of Commissioner Nancy Navarrete from DMS.
Here.
I believe Commissioner Andrew Mays from Commissioner from the Connecticut Insurance Department is on. Is that correct?
I am here. Thank you. Good morning.
Good morning. Commissioner Manisha Tutani, Department of Public Health. Thank you. And we do have a quorum, Mr. Chair.
Thank you very much, Marcin. Could I ask the executives of Access Health to also introduce themselves, please?
Good morning, all. This is James Michelle. I'm the Chief Executive Officer of Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Susan Rich-By, Director of Legal and Governmental Affairs, Access Health Connecticut.
Casio Sabatino, Interim Marketing Director, Access Health Connecticut.
John Carbone, Director of Small Group Product Development and Broker Support.
Good morning, everyone. Glenn Jurgen, Director of Human Resources with Access Health Connecticut.
Good morning. Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Good morning, folks. Janelle Maloney, Director of Information Technology.
Mr. Chairman, that concludes the introduction of our executive team.
Thank you very much, James. We have we've received 3 public comments, and I believe at least 2 of the people who submitted those comments are with us today. So let me begin by inviting Representative Woods to speak in advance of reading her written testimony.
Hi, good morning, everyone. Thank you for allowing me to speak here. I will just summarize my testimony. I did send a letter in from members of the Insurance and Real Estate Committee, so I'll let you read through that long-winded part. But just in summary, our committee has been working on 3 things this past session: healthcare cost containment measures, strengthening the exchange, and creating more options in the small group market. With the proposed increased assessments, I am very fearful of what that will do to our already extremely sensitive, fully insured small group market. I put in the letter just doing some math that this is a potential $70 annual increase. I just think that raising the assessments is counterintuitive to the goals of what we're trying to do with strengthening the exchange. One of the bills that we proposed this year was to lower the premium tax so that we were more competitive around the country to attract more carriers and bring in more business. I'd love if the executive team here and the board would consider some of those. I'm very, very concerned with what's happening here in the state. I mean, the history of our fully insured small group market has seen carriers leaving, has seen that market get smaller and smaller. Those of us that are working with small groups, small businesses and nonprofits are hearing every day the challenges of affording healthcare. I mean, this is also directly related to our staffing crisis within our nonprofits. I am here to just say I am a team player with everyone at Access Health. How can we help you? How can we partner and collaborate to work on strengthening the exchange and bringing more products and options to this market? And then lastly, we're just very much opposed to any more stress to this market. and really hope that you reconsider passing the assessment today. And thank you all for your time.
Thank you, Representative Woods. We appreciate that. And let me say that the exchange looks forward to collaborating with you as well. Let me read your letter, Mr. Bosworth, if you'll just permit me to do that. And so we do these in order, that would be helpful. Thank you. Dear board members, it's come to our attention that Access Health Connecticut Finance Committee is recommending that the board increase policyholder assessments from 1.65% to 1.85% in order to continue funding exchange operations. According to the Finance Committee, the increase equates to $1.44 PMPM. We have also heard estimates that range from $1.60 to $1.80 PMPM for policyholders. While we understand that some individuals on the exchange may be shielded from the increases due to subsequent increases in subsidy, the same is not true of the rest of the fully insured market. By way of example, consider just the impact of a small group of fully insured market segment, the most sensitive market segment, utilizing the AHCT number. And calculation is $1.44 times 12 months equals times 55,000 members equals an additional 950,000 in assessments. A family of four will see premium rises of $70 annually to pay for this one increase assessment. As you move forward with further consideration of this proposal, we ask that you be mindful of not just the impact on the exchange members, but also the impact on the overall commercial group market as well. This is where we see the highest stress levels in the system. On behalf of the insurance committee members listed, we ask the board to consider any and all alternatives before taking action that result in increased premiums, and ask that once again deny this request. We value and appreciate the role Access Health Connecticut plays in delivering health insurance to Connecticut residents. However, as policymakers, we must make tough decisions that assure we are not complicit in the escalating costs of insurance. Premiums continue to increase due to the trends in the underlying cost of care that include new and exciting developments, improving overall health outcomes, but it all comes at a cost to consumers, and that cost is too much. Next week, the Office of Healthcare Strategy will undertake its first public hearing on healthcare cost drivers. We know that hospitals and pharmaceutical costs are among the primary drivers. We know that the past 2 years have been anomalies due to COVID and its impact. We know that the workforce shortage plays a huge role in these dynamics. Now is not the time to increase administrative costs that funnel into premiums as well. The exchange assessment is but one tax levied on the fully insured population. At $30 million annually, it joins a total of $138.3 million in other assessments levied on the industry in support of operations of the Connecticut Department of Insurance, Office of Healthcare Strategy, Office of Healthcare and Behavioral Health Advocates, and programs unrelated to insurance under the Department of Health, among other things. While individual assessment amounts may seem inconsequential when viewed in isolation, combined, they clearly add up to a significant dollars that are borne by the very people who are trying to assist. To add insult to injury, it appears $30 million in assessment funds were swept during the latest budget cycle instead of committed to the general fund. Between that and the fact that the property casualty insurers are now lobbying to exempt themselves from assessment formulas, the time has come to do a deep dive into all assessments and determine their costs and benefits. Our committee intends to hold work group sessions on these issues throughout the interim to undertake that analysis. We are holding health plans, hospitals, pharmaceutical companies accountable for their increases. We must also hold government entities and quasi-public entities accountable to those same standards. We strongly encourage the board to do an accounting of Access Health CT's budget before moving forward with this increase. We also look forward to your participation in our upcoming work group as we explore ways to minimize reliance on these assessments and to fund government programs in the future. This letter is signed by Representative Wood, also by Senator Tony Hwang and Representative Kara Pavlak. And forgive me if I've left out any co-signatories. The letter will be included in the record of this meeting. Also with us today, I understand, is Wyatt Bosworth, representing CBIA. So, Mr. Bosworth, if I could call on you and allow you to make your remarks.
Sure. Good morning, everybody. Thanks for the time. I'll just read verbatim the letter as to save you, sir, from reading it yourself. So,
thank you.
My name is Wyatt Bosworth, and I'm Assistant Counsel for CBIA, the Connecticut Business and Industry Association. We're the largest business organization in the state with thousands of member companies, small and large, representing a diverse range of industries. 93% of our member companies are small businesses with less than 100 employees. Thank you for the opportunity to comment in opposition to the Finance Committee's proposed fiscal year 24-25 budget and the associated recommendation to increase the marketplace assessment rate from 1.65% to 1.85%. CBIA is strongly opposed to this recommendation as it will increase the cost of on and off exchange small group health insurance products. Connecticut small employers struggle every year to keep up with rising healthcare costs. The recent withdrawal of Connecticut from the fully insured market, the rate request made public by the insurance department last week, the failure of Access Health to run a successful shop exchange, and the addition of new health benefit mandates every year have all contributed to a fully insured market that is shrinking and on life support. The approval of a 12% hike in the marketplace exchange assessment will only continue this 5-year trend of small employers either migrating to the level funded market or dropping coverage altogether. As of 2021, the small group fully insured market enrolled 109,000 lives, down from 235,000 lives in 2017. Further, the shop exchange is barely existent with an enrollment number around 3,000 lives. As this market continues to shrink due to the proliferation of level funded products, the creation and expansion of such a market, which is caused by the ability of small employers to cut costs by avoiding unpredictable and costly assessments, premium taxes, and benefit mandates due to ERISA preemption. Access Health should be working to lower the cost of health insurance, not raise the cost of health insurance. Further, as evidenced by the shop exchange's low enrollment numbers, it's counterintuitive to continue to make small employers that purchase off-exchange insurance products subsidize individuals and Medicaid recipients who actually utilize Access Health resources. Why should small employers continue to pay for an exchange that they do not use and that has failed to offer competitive products? Access Health was prudent in its decision to reject last year's marketplace assessment increase and opt instead to cover the budget deficit with budget reserves. CBIA urges Access Health to do the same this year. Small employers simply cannot afford any more unnecessary costs. Thank you for your time.
Thank you, Mr. Bosworth. Appreciate that. We have one other comment letter. It's come from the NFIB, and I don't know if there's a representative of that organization with us on the phone. So let me stop and ask, is there a representative from NFIB? If not, I will read the letter that they've submitted into the record. And again, these will be posted as well. NFIB is committed to seeking healthcare reforms, particularly those that address rising healthcare insurance costs that can help small business owners and their employees. As such, NFIB has significant concerns with the proposed marketplace assessment as reflected in item E on today's agenda and suggests the measure be tabled or rejected at this time. Increasing the assessment that will be charged to plans in the small group and individual markets will adversely impact small business owners and potentially higher premiums and does nothing to decrease or help address the rising cost of health insurance. According to the 10th edition of Small Business Problems and Priorities by the NFIB Research Center, published in July 2020, cost of health insurance continues as the #1 small business problem, a position it has held for 29 years. Health insurance costs for small businesses have risen 43% in the last decade, outpacing wages and inflation. Further, according to the recent Small Business Health Insurance Survey by the NFIB Research Center, published March of 2023, the most important reason small employers don't offer health insurance is that it's too expensive, with 65% reporting this reason. 94% of small employers find it challenging to some degree for their businesses to manage the cost of offering employer-sponsored health insurance. The impact, there's a gap in this text, so I'll just keep reading. In addition to being the most reported reason for not offering health insurance, cost is also a critical problem for those offering health insurance. Almost 98% of small employers offering health insurance are concerned that the cost of providing health insurance to their employees is becoming unsustainable in the next 5 to 10 years. The impact of rising health insurance premiums continue to be far-reaching within the small business sector. Almost half, 49%, of small employers have taken a lower profit or suffered a loss to pay for health insurance premiums increases over the last 5 years. 46% of small employers have raised prices. Another 36% have become more productive and efficient. 18% have increased employee cost share. 17% have said they have delayed, postponed, or reduced business investment, and 11% said freeze or reduce wages. NFIB's goal is to ensure that small business owners can have access to health insurance that is affordable, flexible, and predictable. But further increasing the assessments at this time of high inflation, workforce shortages, post-pandemic economic recovery will do nothing to stabilize costs in the ever-shrinking market available to small businesses and their employees. As such, NFIB encourages board members to strongly consider the effects of today's potential vote on those who purchase insurance in the fully insured market, and to reject or delay the increase in assessments until such time as alternative funding sources, including budget reserves, as well as savings from non-recurring expenditures such as IT updates that have already been completed, can be fully explored and weighed against the impact of increased assessments on fully insured policyholders and the market as a whole. Thank you to the board for your consideration of NFIB's comments and concerns on behalf of small business. For any questions or additional information, please feel free to contact Andy Murkowski, NFIB's State Director in Connecticut, at 860-248-NFIB, and then he gives also a web address. That concludes the letter from the NFIB. Are there any others who have joined us today for public comment?
Yes. Can you hear me?
Yes.
Hello? Okay.
Hello.
Representative Meskers from the 150th District.
Hello, Representative Mesker.
Thank you very much. So, look, I sit on the Insurance Committee. I am also signatory of the letter issued by Representative Wood. And as well, I'm Chair of Commerce. And I think if you take the common thread of the letters in opposition, essentially the rising costs are providing a hurdle to small business owners. And it's providing an obstacle to the growth of the state. And these assessments are, at some point either need to be transferred and looked at to the general fund, or they need to be contained. Because expecting the individual purchase of insurance to absorb these fees is going to make insurance a larger and larger luxury or an option, or you're going to end up with insurance plans with ever higher deductibles that become nothing more than catastrophic insurance. So I think we really have to look going forward at what we can do to contain the costs. So I urge you to reject the increase in costs. And as I said, I joined Representative Wood on the letter that they wrote.
Thank you. Thank you very much for the comment. Are there any others?
Yes, this is Senator Huang, the ranking member on the Insurance Committee, and also a signatory on the letter as well. And my comment would be aligned with the chairwoman, Representative Wood, and Representative Mesker, but also re-emphasizing that greater communications. I think for us as an insurance committee leadership, we have always made ourselves available to your organization, and I hope that in moving forward, that we have greater communications and equally greater transparency in how we can reduce costs and increase efficiencies. So I think this meeting is quickly and abbreviated, but nevertheless, I hope it'll be a start of a better collaborative and communicative relationship moving forward. So thank you very much.
Thank you, Senator Wong. I acknowledge you are our signature to Representative Wood's letter, and we look forward to the collaboration as well. Anyone else? All right, thank you very much. Thanks for all who have joined us today. And thank you for your comments. The letters that you've submitted will be included in the record of this meeting. Let me move on to ask for if there are any questions regarding the minutes of the last meeting, or comments or corrections. Hearing none, can I have a motion to approve the minutes from the last meeting?
This is Claudio. I'll make such motion to approve the April regular meeting minutes.
Thank you, Claudia.
Paul, second.
Thank you, Paul. Any discussion? If not, this is Charles Klippel, yes.
Thank you. Paul Philpott?
Yes.
Claudio Gualtieri?
Yes.
Deidre Gifford?
Yes.
Grant Ritter?
Yes.
Stephen Hernandez? Andrea Barton Reeves?
Yeah.
Thank you. Theodore Doolittle?
Yes.
Cece Woods? Thomas McNeil? And Matthew Brackman?
Abstain.
Did you abstain, Mr. Brackman?
Yes. I don't think I was at the meeting.
Okay, thank you.
Thank you all. James, the CEO report, please.
Good morning, Mr. Chairman, and good morning all. And let me first extend my appreciation for the speakers this morning. Just one comment for the record, I would like to clarify. One of the speakers mentioned that assessment dollars may be spent on Medicaid. I want to be clear about that. None of the assessment money is allowed, and we do not spend any assessment money on Medicaid at all. Just want to put that on the record. But I also want to extend my that the Access Health, we continue to work every day to find to make ourselves more efficient, to minimize costs on the industry, so much so that that we have not raised the assessment in 8 years. As we all know, the costs of doing anything have gone up dramatically, especially in the areas of health, salaries, also insurance. Cyber insurance has been climbing for us. So again, those costs are going up, and as you will hear pretty soon, we actually reduced our operating budget by $734,000 by investing less in major IT projects. I just want to clarify that, but I deeply appreciate all the comments that I made today. Most of them align with where we are in terms of managing our costs to make sure we minimize costs to the industry. We will be reaching out to all the speakers to and engage with them, and obviously further our collaboration with them. So we look forward to speaking with all of them to get their input as we move forward collaboratively to try to improve access to healthcare to all Connecticut residents. Again, good morning. Well, I'm James Michel, the CEO of Access Health Connecticut. Welcome to our June board meeting, and thank you for joining us today. I want to mention a few things before we get started. We are working on a 5 to 10 year plan with the strategy committee led by Steve Hernandez. We have reached out to some of you for your input over the last several months, as well as our senior staff. We are currently putting together a planning document. One of the key areas of focus for us will be how do we improve our system and to make it easier and better for Connecticut residents to apply for health insurance through Access Health. Again, we've been using the same system, the same technology for 10 years. When we first implemented it, it was 10 years old. So you imagine the progress that's been made in 10 years with respect to other technology solutions that you've used. So this is a key part of helping to address health disparities, as well increasing the enrollment of Connecticut residents, giving them access to health insurance. We look forward to sharing this progress with the board in the coming months, and we are calling this project 10 Clicks or Less. Our goal is to have Connecticut residents who apply for health insurance to Access Health to enroll in 10 clicks or less. It is an amazing, it's a very aggressive strategy. Again, the purpose of doing it, being so aggressive, is to make it as easy as fast as possible for individuals in Connecticut to apply for health insurance to Access Health. I also would like to introduce Ezio Sabatino as Interim Director of Marketing, as Caroline is on maternity leave. Ezio comes to us from after he retired from Connecticut. He brings a wealth of experience in the marketing space to Access Health, and we are very fortunate to have him on board at this point. Regarding our meeting today, we will begin with a finance update. We will ask the board to vote in support on the fiscal year 2024 proposed operating budget, which reflects a $734,000 reduction from fiscal year 2023 due to us spending a little bit less money on big IT projects. We do have some increases in other areas of the budget, such as salaries and benefits, so that we could maintain stay competitive. We strive to be as efficient as we can and continue to streamline our costs, which we have been able to reduce by 10% annually over the last several years. We will also discuss our request for a 0.2% increase to the assessment, which was discussed with the Finance Committee last week and approved unanimously. This is a modest increase and the first one in 8 years. We believe this is a responsible decision, and as our customers who receive advanced premium tax credit will actually see a reduction in premium costs of an average 4 cents during 2024. Sinisha Krankovich, head of financial planning and analysis, will walk you through the proposed FY 2024 budget. After that, Tammy Hendricks, Director of Health Equity, and Ezio Sabatino, Interim Marketing Director, we share the progress made on Medicaid Unwind, and specifically Medicaid Unwinding has been going on very well, and we are in full execution mode. This month, we will begin to air a modest number of TV commercials targeted at areas of the state with the highest number of Medicaid Unwinding customers, as a way to reach people who may not have received the information mailed to them due to an address change. And Tammy Hendricks will give you a quick update on Broker Academy, which began with in-person training earlier this month. Then John Carbone, Director of Shopping Business Development, will summarize the first Small Business Summit hosted by Access Health last week. And I also, Susan Richbauer, will give you an update of where we are with our audits. We have a number of audits going on right now. She'll give you an update on the financial audit for 2023, as well as the state-based market annual reporting tool for 2022, which CMS requires us to do every year and refer to as SMART. With that, Mr. Chairman, I will turn the meeting back over to you. Thank you very much.
Thanks, James. Welcome, Ezio. Glad to have you with us.
Thank
James,
you,
I think
Mr.
I'm
Chair.
actually just turning it back to you for a finance for the
Thank you very much.
finance statement.
Thank you. As stated in my opening comment, this budget we believe is very responsible. We went through every line item within the budget to minimize any costs, any unnecessary costs. We have actually reduced the budget by $734,000 by reducing the amount of IT projects that we are looking to do next year. So I'm going to ask one of my colleagues from the Finance Committee to go ahead, Sinisha. So I want to take over and share with the board that our proposed FY 2024 budget.
Thank you, James. Sinisha Tsurunkovich, Head of Financial Planning and Analysis at Access Health Connecticut. I'll be presenting you the fiscal year 24 proposed budget as well as the proposed assessment. First, we'll talk about the fiscal year 2024 proposed operating budget. The fiscal year 2024 proposed budget is $734,000 lower compared to our adopted fiscal year 2023 budget. And as James mentioned, that's mainly due to us not investing in large IT improvements in the next fiscal year. And I'll go into a little bit more detail on the next slide on the proposed budget. On the revenue side, we expect to we continue applying for grants and expect another $100,000 in next fiscal year at the minimum. We are not, as you might know, we have in the past year used reserves to fill gaps in our budget, including $1.2 million for IT improvements, as well as another $2.7 million that was approved in April to fund the Medicaid Unwind marketing and outreach. And we are not planning to use any more reserves as our reserves are shrinking. The other revenue line there, that was a gap that also came out of reserves for most part, but also rebate revenue. We have been earning rebates by paying our vendors using a credit card, which has helped us, and we continue enrolling vendors. The marketplace assessment is decreasing because of the small businesses moving to self-funding mostly. And you'll see the proposed assessment rate increase of 0.2% would yield $1.85 million on the fiscal year basis. On a calendar year basis, that would be double that amount, or $3.7 million. On the expense side, the salary costs have increased because we have hired contractors into employees. So you'll see that our contractual side has decreased. And as well as that, we have budgeted 3% salary increases, which are based on merit. The benefits costs are going up. There's a 7.5% increase in medical insurance. There are other retirement plans and other benefits as well. On the temporary staffing, the cost of hiring staff has gone up. The equipment and maintenance, we are still working on a transition from our enterprise operating model vendor from Deloitte to Infosys Public Services. So there are those transition costs in there, as well as increased maintenance cost. And as I mentioned earlier, the IT enhancements line, that's where the IT projects are, and IT investments. We have decreased that line. We're not going to do those, so that way we can fund this budget. I'll stop here if anybody has questions.
Tanisha, the only comment I want to add to your presentation is that on the IT enhancements, we are reducing it by $1.8 million, about $1.9 million. However, we are continuing to look at our IT and implement all the necessary requirements based on federal and state requirements, IRS and CMS requirements. Those will continue to be done. And also, we are investing money in our cybersecurity space as well. We're just not doing any big major IT projects this year. And again, very quick, some commentary around on the upper part of the budget. We are looking at the just quick other revenues, the $26,400. Most of that will be rebate revenue. Again, we believe that's a conservative amount. And last year, Daryl, who left us back in March, put together a strategy to come up with we're actually leveraging the state of Connecticut's approach to paying bills, as well as something he did in New Haven when he was head of finance in New Haven. We pay most of our vendors, some of our vendors, with a credit card, and we get a rebate from that. And that's going to add some additional revenue stream for us. But again, we are looking to expand that by paying more vendors, especially our bigger vendors. If we're able to pull that off, then we'll realize more revenues from that process as well. So that's an ongoing effort on our part to bring in the additional revenues and while we minimize any future increases to the assessment. Thank you.
Martin, if you want to move to the next slide, please. Thank you. The fiscal year
Excuse
20.
me, could I ask a question about the last slide?
Sure.
One of the really big expenses here in 2023 was the Medicaid unwind. Probably old issue, but is there any possibility of getting some funds from the federal government, or is this personally our share of the Medicaid unwind and that we had to eat ourselves? This is Grant Ritter.
Grant, yes, DSS, the Medicaid unwind is for the most part is a DSS responsibility and effort, but we do have a role to play in that. In that, a good number of those folks coming off Medicaid may become Access Health customers. So that's why the $2.7 million that we are spending on marketing and outreach,
right,
it's an acquisition cost for us. But DSS, we are collaborating with DSS and OHS in some cases to minimize cost to Access Health because they are getting some grant funding from the federal government on their part. So there may be something down the road.
Okay.
But our cost is $2.7 million, and there
right
may be
now,
some.
Yeah.
Yes. Well, that's the most we will spend. We're not spending more than that, so it may be less if we're able to get some grant funding through pass from DSS to us.
Great. Thank you.
And this slide presents the DSS shared cost proposed budget, and there are no changes on the overall DSS shared cost. And this has been, approved and reviewed with the DSS staff as well. Unless there are any questions, we can move on to the assessment. So on the assessment, we will talk about the revenue and the outlook and how are we addressing the shortfall. So I will go to the next slide and we'll start talking about the assessment. So assessment revenue and looking at the outlook, how are we doing? In the past 4 years, our assessment revenues have declined. At the same time, the operating costs have increased, and they are projected to outpace revenue by $4.3 million in fiscal year 2026, as you'll see on these charts here. I will talk a little bit more about the gap on the next slide. As far as the fiscal year 2024 goes, you'll see a chart down at the bottom, how we are funding our budget. There's a $2.6 million gap between the revenue and the expenses. And this gap is covered, as you'll see, the assessment revenue prior to increase is $30.8 million. But we are also getting grants. There's an interest income, which we've been lucky that the interest rates has helped us because we have money in our reserve. So that's helped us raise some interest income. And then as well as that, there's a rebate revenue that we mentioned. But however, those are not enough to cover our gaps. So that's why we're asking for an increase of 0.2%, which would yield $1.85 million on a fiscal year basis. The proposed assessment increase would start on January 1st, 2024, which will yield the $3.7 million on a calendar year basis. And for fiscal year 2024, like I mentioned, that's translates into $1.85 million. The next slide, please. Our revenues have been declining and the costs have been increasing at the same time. And the revenues mainly are declining due to the shrinking of fully insured small group market caused by the small employers moving to self-funded products. At the same time, there are new costly requirements by CMS, the state and internal revenue services, which are increasing our cost beyond our regular operating costs, such as salary costs and costs of maintaining our systems. So some of the examples are they are changing digital environments, especially on the security side, which are costing more. And everybody knows that the IT security environment has become more costly for everyone around. Last year, we absorbed the cost of or part of the cost of the all-player claims database. And then we are implementing system changes, such as the Covered Connecticut and Medicaid Unbind, operationalizing those changes. So those are increasing our cost as well. The next slide, please. Access Health has been addressing these challenges by lowering the operating costs in the past few years by 10% and creating efficiencies to meet our organization or to meet our objectives. Last year, we utilized $1.2 million in reserves for IT projects and initiatives, and an additional $2.7 million for Medicaid Unwind. We have received $122,000 in grants to fund the Broker Academy.
Mr. Chairman, very quickly, some of the steps we have taken to manage costs. But several years ago, we asked all of our vendors who have been with us since we started to reduce their operating their cost by 10%. Because the assumption on my part was that when they first started with us, there was a lot of risk, not knowing what was going to happen. And in some states that they were right, some of the exchanges failed. But since we felt after 5 or 6 years of operation, most of the risk associated with for new startup were removed. So we asked them to go back over the next 3 to 4 years to reduce their costs, and they did not blink an eye. This is our printing, scanning vendors. And so they reduced their cost by 10%. So again, we're trying to find ways to minimize our costs and new revenue streams. Again, to minimize any increase at all to the assessment going forward. We will continue to look at ways to make us more efficient. We've also reduced our costs by bringing in some work that used to be contracted out in-house. We think not only is it more reduce our costs, but also makes us more efficient. And instead of having to go out and hire contractors in where it's hard to predict costs by having our staff, we know what the salaries are, so it's a lot easier to manage those costs accordingly. And those are the steps we continue to take to reduce the stress on the premium going forward. Thank you.
Thank you, James. If you could move on to the next slide, please. So our recommendation is increasing the assessment from 1.65% to 1.85%. This will still be the lowest rate in the country, and I will show a chart in the next slide or two. Like I mentioned earlier, this would generate a $3.7 million in a calendar year, and for fiscal year 24, that would be the 1.85. Next slide, please. So this chart shows you the assessment rate for the state-based exchanges around the country at the moment. And like I mentioned, we will still be lowest at 1.85% among those states. One other thing to make you aware that most of the other states this might not be an apples to apples comparison. Some of the other states might actually be getting some funding from the state on top of that. Like they might be in the buildings, in state buildings, for an example. So they're not paying for that. Well, we have to pay for our own insurance. We have to pay for the rent of our own space. Those are some of the examples.
Yeah, Mr. Chairman and members of the board, Smith makes a great point here in that we are not comparing orange to oranges because many of those states are in state-funded buildings, so they pay no rent. Many of them they are insured through states' budgets in terms of state self-insurance programs, so they're not paying for their own cybersecurity or their own general liability insurance. Where we are, everything we do, we are fully funded through assessment, and yet we're still lower than most of them. Again, I'm just making you aware that Connecticut has a very good deal in how the exchange functions and the assessment that we charge, and also we continue to be, at the risk of sounding self-serving, the best exchange in the country. Again, this is not just by us, but we've been recognized across the country for the work that we've done, the ease with which our customers are able to enroll. And we know we have our challenges, but other states are nowhere near where we are with respect to individuals' ability to enroll through a very user-friendly technology solution. Although we know we have our challenges to overcome.
Thank you, James. Next slide, please. So we have worked with our actuarial contractor and to do some projections on the assessments. And I will let Julie speak on this slide and provide you a little bit more detail.
Yes, good morning, everyone. My name is Julie Andrews with Wakely Consulting Group, and we did some modeling and projections of the assessments. And based on 2023 premiums, a 0.2% increase in the assessment would translate into about $1.44 per member per month per individual in the marketplace. Now, because of the unique environment in the individual marketplace, many individuals are eligible for premium tax credits. And because of the mechanism of increasing the second lowest cost silver, which is the driver of tax credits, the majority of individuals will receive an actual decrease in premiums on a net basis of about 4 cents per month. So for those individuals that receive tax credits, which is about 86% of QHP enrollees, they will actually see a decrease after implementation of the assessment change.
Thank you, Julie.
Thank you, Julie.
In the last board meeting, the board has asked a few questions about our reserves. And this slide here shows you our projected reserve at the end of the fiscal year 24 to be at $19.2 million, which would translate to about 6.8 months of operating funding. And if we move on to the next slide, with that in mind, we have done some research on the reserves at other state-based exchanges, as well as quasi-public agencies in Connecticut. Looking at this research, the organizations that do have unrestricted reserves maintain a minimum of 6 months of operating reserve. And based on our preliminary data and our experience, Access Health recommends at this time to maintain an operating reserve of 9 to 12 months. We will still continue to do further research on the reserves, looking at some other nonprofits as well.
Mr. Chairman, this was a request of you and the board at the April meeting that we look at what first of all, what other states are doing with respect to reserves, and come up with a base for Access Health the minimum reserves. And at this point, we are recommending a range. Again, we are still, after discussing with the Finance Committee, we're still exploring to see what other nonprofits are doing, to see whether 9 and 12 months is the appropriate reserves for us. Again, the other state agencies, quasi agencies, they all, some of them have reserves, but a lot of reserves are restricted. I mean, they are dedicated for specific purposes going in the future. But the 3 exchanges that do have reserves, it range from 12 to 15, 6 to 15 months. And we think at this point, given that many of them have some of the expenses are sunk into the state budgets, we don't have that luxury. So that's why we think a 9 to 12 month is an appropriate reserve cap for us at this point. But we're going to do further research to make sure that's the right basis for us. Then what we owe the board is a policy going forward on how we and what triggers the use of the reserves, and we are working on that and hope to bring it to the board before year end.
Yeah, James, thank you very much. We did request this, and any organization needs to have a prudent level of reserves, and so this is very helpful to understand kind of where the reserves are and to try to establish that sense of prudence. So I appreciate it, and we look forward to the recommendation at a subsequent meeting.
I believe this is the last slide of the finance update. Are there any other questions? Comments?
Are there any other questions or comments from the board? We're going to follow this with 2 votes. First being a vote on the budget itself, second being a vote on the assessment increase. But again, let me hesitate and hear whether there are any comments first, and then we'll talk about the votes. Okay, thank you all very much. Thank you for the detailed update. We appreciate that. Oh, Commissioner Reeves, please.
I'm sorry, I'm not in my office. I couldn't get my hand up fast enough, so I apologize. But it seems that the vote on the operating budget and the assessment are intertwined. So I just don't know how we're going to vote on one and then the other. I just wanted to understand how we would work through that operationally, and will there be time for a discussion regarding the comments that were made during the public comment period?
It's a good comment, and I think maybe the way to do it is perhaps to do the votes the other way up. That is to vote on the assessment, which is built into the budget, so that we're not de facto voting for it in the budget vote. Would that make sense to you?
Yes, it would.
Let's do that then. And so the first vote I'll call for is the vote on the assessment. And in that regard, I would welcome comments from any of the directors with respect to the assessment increase and or the comments that we've received this morning.
Do you mind if I start, Mr. Chair?
Please, I do. That would be great.
So I along with James, really am very thankful to the legislators for the very thoughtful comments that they made regarding the assessment and from the CBIA as well, and I appreciate those. What we don't have, however, before us are sort of immediate solutions or even some longer term solutions to close our imminent budget gap, and and to address sort of the longer term rise in costs that are inevitable in doing business. So I guess we should, I'm very curious to hear what others might be thinking or saying, but I think we might want to consider things like whether or not we should take up our legislative colleagues on their offer to think about other ways to finance this if they're willing to help us do that. But right now, I see our options as rather limited within our resources, but I'd be very curious to hear what other board members say as well.
Thank you. Claudia?
Yes, thank you, Mr. Chair. I want to also appreciate the constructive comments offered in the testimony and the time, especially from Representative Wood, Senator Huang, and Representative Mesker, who took not only the time to write to us and provide some thoughtful guidance for the board's reflection, but also took time out of their day-to-day to verbalize and enhance and add to those comments. Let me also say I agree with their recommendation that we must fully account for the Access Health CT budget, and we must explore any and all alternatives first. This is the very same position, in fact, that I and many board members here with us today advocated last time a similar proposal was presented. At that time, we prevailed, and we took those prudent steps and necessary steps. Board members participated in a series of budget workshops. We asked and dug into all the budget decisions, the assumptions, the trade-offs of the various line items. We were afforded opportunity and ample discussion to fully understand and vet the details of the budget. We also at that time directed Access Health to draw down on a healthy reserve that had built up over time and to make some strategic assessments on what is the right level that a board like Access Health should have in terms of reserves. And let's have a path forward to maintain that reserve, but not extra, not on excess costs if we can avoid increased assessments in the future. We also directed Access Health to aggressively pursue federal and other grant opportunities. We see some of the fruits of that work materialize both in last year's budget and again on the assumptions of the budget before us for a vote today. Finally, we asked for the belt tightening and streamlining of costs that every family has had to do, especially in the times of economic uncertainty and inflationary increases. For me, the question now is what comes after those alternatives, after we've explored the means and all the other options that we could have pursued. And on this, I also agree with the testimony of the Insurance Committee members. Context and impact on individuals has to be paramount. For me, there are a few factors that weighed heavily in a decision for today. First, last time we were presented with this, there was a large degree of uncertainty on whether any of the enhanced ARPA, American Rescue Act plan, subsidies for the exchange would continue. Subsequent to our consideration last year, Congress wisely passed the Inflation Reduction Act, making a longer-term extension of those enhanced subsidies all the way through 2025. That gives us some assurances based on the modeling that we've heard today and the Finance Committee heard earlier that a lion's share, 85, 86%, will see no increased costs, those that shop for qualified health plans and receive subsidies, and in fact may see some minor negligible decrease in their premiums. Secondly, the public health unwinding is a major disruption and a factor that we have got to grapple with. As a result of the public health emergency coming to an end, folks who have been able to retain on Medicaid will now have to go through a process of redetermination or a de facto process on the back end where we are able to auto and re-enroll them into Medicaid. There is the potential risk that people who had coverage will lose coverage. And it's a unique situation, a once in a lifetime, let's hope, pandemic that has created this unprecedented opportunity where a lot of people may find themselves having to shop for health insurance. And we also have the great benefit in Connecticut of a new program, Covered Connecticut, that will act as a quasi-Medicaid program on the exchange that will function to provide some coverage and close the affordability gap. But that takes resources, that takes attention, and that takes the full commitment of the board and stakeholders and partners, including the insurers who I hope will be part and parcel with that work with us. Another factor that's really important to me is that in Connecticut, we're fortunate to have 90+% of residents covered by some form of healthcare coverage or Medicaid. And that means that those left without coverage are going to be some of the most difficult and hardest and challenging to reach. They're not going to be reached by mass mailings or collective strategies that are sort of the typical run-of-the-mill work. It's going to be hand-to-hand relationship building, trusted advisors, broker academy, and all other on-the-table resources. And finally, for me, is the fact that this assessment will still ensure that Connecticut remains competitive in respect to the federally facilitated exchanges and every other state exchange. We will still be the lowest assessment rate in the country. All these factors and Commissioner Barton Reeves' point of what are the alternatives that we have for the immediate crisis put me in a position where I think the time has come for a prudent and responsible, modest increase as proposed in this budget. And I'm willing to support that here today. I also accept the invitation of Senator Huang, Representative Wood, and others that we really need to get at the root cause. That is a cost that we've got to, the costs that are driving healthcare spending and making healthcare generally unaffordable. We've got to grapple with that. We started to do that this year, thankfully, with the governor's leadership and the support of many on that committee and other committees, including public health. But we've got to take seriously the root causes of healthcare costs and rising costs. So thank you, Mr. Chair.
Claudia, thank you very much. May I ask any of the other board members for comment?
Mr. Chairman, I think Paul, the CID, Insurance Department, have their hands up.
Sorry, Paul, please.
Thank you. Good morning, everybody. This comment is purely related to a technical process. FYI, as all of the health carriers submitted their rate filings June 1st of this year for effective dates that are 1/1/24 and beyond, they filed their rate increase requests using an assessment of 1.65%. If this assessment, marketplace assessment, is increased to 1.85%, that will have to be addressed with the CID and the health carriers during our active review of the filings before a disposition is made on the filing. So it's purely technical process, Charlie. Thank you.
Thank you. Thank you, Paul. I appreciate that. Dr. Gifford as well, please.
Thank you, Mr. Chair. I want to echo, I don't have much to add to the really excellent comments that Claudio made about this issue. I do also, though, want to add my thanks to our legislative colleagues who have taken the time and made the effort to participate constructively in this conversation. And as Charlie, our chair, indicated, I think all of us on the board are, and the staff at Access Health are anxious to continue the open conversation and collaboration. I think it was really helpful for Claudio, our finance chair, to walk through the actions that the organization has taken since the increased assessment was first proposed and delayed until this vote. I participated in many of those activities, and I think that we've gone a long way towards addressing many of the concerns that our legislative colleagues and CBIA have brought forward. Not to say that there isn't more work to do, and I think we all agree that continued vigilance around the spending of the exchange is important. I do think it's striking that we are the lowest assessment in the country and substantially below the states that have chosen to go with the federally facilitated exchange. That is meaningful to me and an indication that we are both with our reserve amount and with our assessment prudent in the way we are assessing and spending our funds, which is important. We don't want to be an outlier in either direction. And finally, I just want to really emphasize the last point that Claudio made about what's driving these the underlying drivers of these increasing costs. I think there's universal agreement among everyone who spoke this morning, all of us on the board and the staff at Access Health and our legislative colleagues, that the drivers of healthcare costs are really need to be the focus. Next week, the Office of Health Strategy will have our first benchmark hearing, during which we will speak with parties to the healthcare system and talk about the underlying drivers and work towards solutions. I think Access Health wants to be and needs to be part of that conversation. And then a point that Ted Doolittle has been making persuasively is that we all need to, I think, start taking a closer look at this shift from the fully insured to the self-insured small group market, what the impact of that is collectively on consumers and employers, and whether there are further actions that we as a state may want to think about in that regard. So I appreciate the work that's gone into, the thoughtful work that's gone into this proposal, and I will be in support. Thank you, Mr. Chair.
Thank you, Dr. Gifford. Ted Doolittle.
Yes, thank you, Mr. Chairman. Now, are these comments in lieu of discussion after we have motions? Because I'm happy to go now if we want to, truncate that portion of the meeting.
If we can, let's do them together. Although I will formally ask for comment, but let's do them now. I think that would be helpful.
Okay. In that case, I want to first associate myself with the remarks of Mr. Galtieri as well as Dr. Gifford. And for those consumers at home, the Office of the Healthcare Advocate, we represent you folks when you're fighting a health insurance denial or something of that nature with the insurance company. So we're in the trenches on the burdens, the financial burdens that are borne by families every day. So I just want to reflect a little bit on the fact that this is an increase of 0.2%, and we haven't had an increase in 8 years. So on a yearly basis, we're talking about an increase of not 1/10 of 1%, but 1/4 of 1/10 of 1%. Now, in our inflationary times, I don't know what inflation is running at, 7%. That is not too bad to have an organization that is asking for a yearly, spread out over 8 years, increase of 0.025%. I also want to mention that this, as Brother Lombardo referred to, we are in the rate increase season, and I'm sure a lot of the ammunition on the comments, was vetted with, if not coming from the insurance plans. I think it's important to notice that when we are talking about this increase spread out over 8 years of 0.2%, we are being asked, CID is being asked to approve average rate requests of 15%. That's full percents, not 0.00 something like we're talking here. So 15% increases are on the table for this year alone. When you add up all the increases over the past 8 years, I don't know what that adds up to, but it's a lot. And folks, remember, from the burden perspective, the burden of families at home, the 15% is really a false and incomplete number, because the other half of the expense that is borne by folks is their out-of-pocket costs. And the premium rate requests should but do not include how much the out-of-pocket costs are sought to be going up. So we're talking about 15% that we can see they're asking for this year. And then there's the hidden out-of-pocket cost increase that they're asking for. We don't know what that is. So to build on Dr. Gifford's point, we need to look there. We need to look there to control the cost. And when you do follow the money, we're into hospital costs and pharmaceutical costs and others. I appreciated Paul Lombardo's comment about the rate requests having been built on the 1.65% that was from the previous year. I would point out also, though, in terms of reserves and so forth, that the rate requests that we're seeing are built on pandemic reserves and other reserves that are outdated. We now know what happens in a pandemic, which is that the insurers have the best year ever because people stay home and don't get care. And the other thing that we know that happens is that the federal government comes in with money. That's not free money. It does go to all taxpayers in the country, but nevertheless, that is what happens. And so this 0.2% spread out over 8 years increase really pales in comparison to the examinations that the insurer should be doing in terms of, can you get your prices down with Hartford Healthcare 0.2% to offset this? I think you probably can. And can you get your pandemic reserves down 0.2% to account for this? I think you probably can. So my hope, Paul, is that there will not be an impact on the premiums. But I wanted to commend the staff for keeping such a lean operation. It was striking to see that we will remain, by actually a fairly good margin, the most efficient in terms of the assessment that we charge. And again, I would tell the insurance companies that there's a lot of 0.2% out there that you can and should be looking at before you come looking for this particular one, which is the product of a lean organization that hasn't sought increases in 8 years. So those are my comments, Charlie. I appreciate the time.
Ted, thank you. Thank you very much. Are there any other comments from the directors?
Hey, Charlie, this is Paul. I've got a question for Paul Lombardo. Paul, on those rates that are filed for January 1st, do you have any idea in the aggregate what the PMPM cost of healthcare is on those rates?
Well, Paul, our comment was strictly related to the increase in the assessment.
Right.
Our analysis is ongoing, and so it's under review, and we don't make public comments during the review process. So, we'll have to determine, and we can get answers back to you at the appropriate time. Once the decisions have been made, and we are going to have an informational session as we've had the last couple of years. We will hold that, and we will be able to provide that more concrete information to you at that time once all of the decisions have been made. We just wanted to point out from a technical standpoint that that the filings do have to reflect the slight increase from 1.65 to 1.85 if this marketplace assessment is voted on and passed. That was the only reason for the comment.
Right. Okay. Well, so let me, as somebody that's been in this industry for a long time, I think I'm safe in saying this, and that is that the PMPM cost of healthcare, to include hospital and pharmacy costs, I'm sure is a heck of a lot larger than $1.44. And I'm going to speak for myself, but I think a lot of other board members feel the same way. And that is that if there's anything that we can do working with the legislature to address the big reason that small businesses are struggling with these premiums, we would be delighted to do that. I think Claudio Gualtieri, our finance chair, did a great job explaining precisely why, when you look at the context of all of this, that a 20 basis point increase is justified. And Claudio, thank you so much for doing a great job with that.
Thank you, Paul. Any others? Okay, this is Charlie Klippel. Let me be brief, but add my own comments. First, James, thank you to you and your team for presenting us a budget that actually is a decrease from last year. I know how difficult that is to do. It represents really thoughtful belt tightening in order to make the exchange as efficient and affordable as possible. And it is not by accident that we are the least expensive exchange in the country. It is because of your leadership, which I really appreciate, and that of your team. Secondly, Claudio, your leadership as our finance chair has been extraordinary. You've led us to really examine all of our opportunities, all of our choices, all of our costs. And we have, as you say, taken an entire year to re-examine these same issues. I believe we are at the point where this is the right action for the exchange. It is a small move, as Ted in particular has pointed out, and I support the rate increase this time around. That's my view. And then finally, again, to echo the sentiments of others, I was impressed by the commonality of concerns between the points expressed by the legislature and by CBIA and the concerns of the exchange. We share much, if not all, of the same concerns that we need to address the underlying cost of healthcare. And let me be quick to reinforce the view that to the extent that the exchange can help, to the extent that any of us as directors can help, we are delighted to be part of that discussion, part of the effort to try to move that forward. So thank you for all our comments as well. With that, I am going to ask for the vote. Let me frame the vote to increase our assessment from 1.65% to 1.85%, effective January 1st, 2024. Have I framed that correctly?
Mr. Chair, yes, you did. I just want to make sure that it's correctly phrased. Chair Charles Klippel will request a motion to approve the exchange's market assessment rate of 185 basis points for calendar year 2024 as presented by exchange staff and approved by the Finance Committee.
Better said. Thank you very much for that.
Excuse me, Charlie. In what Marcin said, I didn't hear the new rate. Maybe I missed it.
185 basis points for calendar year 2024.
Okay.
So increase to that number. Yep, for 2024. All right. Could I have a motion to approve that vote?
So
Yeah.
moved, Mr. Chair.
Thank you. Second.
Seconded. This is Grant.
Thank you, Grant. I'm going to again ask for discussion, although I appreciate that we've had quite an extensive discussion. Is there any further comment? If not, then this is Charlie Klippel. Yes.
Paul Philpott.
Yes.
Claudio Gualtieri.
Yes.
Deidre Gifford.
Yes.
Grant Ritter.
Yes.
Stephen Hernandez. Andrea Barton Reeves.
Yes.
Theodore Doolittle.
Yes.
CC Woods. Thomas McNeil. And Matthew Brackman.
Yes.
Thank you.
Thank you all very much for that. Appreciate your all the work that brought us to this point. Let me now go back to the other vote, which is the budget, and ask again for any discussion of the budget before we take a vote on that. Marcin, can you back up the slide?
I did already, Mr. Chair.
Oh, sorry. Okay. It's just a delay on my end. Sorry. Any comment on the proposed 2024 operating budget as presented to us a few minutes ago? If not, can I have a motion to approve the proposed 2024 operating budget as presented and approved by the Finance Committee? And Marcin, again, you may want to frame that vote in your terms.
Okay, Mr. Chair, will request a motion to approve the fiscal year 2024 proposed operating budget as presented by Exchange staff.
Yes,
Perfect.
motion to approve. This is Grant.
Thanks, Grant. Second?
Second, Gifford.
Thank you, Dr. Gifford. Any further discussion? If not, Charlie Klippel, yes.
Paul Philpott,
Yes.
Claudio Gualtieri,
Yes.
Deidre Gifford,
Yes.
Grant Rader,
Yes.
Steve Hernandez, Andrea Barton Reeves,
Yes.
Theodore Doolittle,
Yes.
CC Woods, Thomas McNeil, and Matthew Brackman.
Yes.
Thank you.
Thank you all very much. Important issue, and I appreciate all the discussion that we've had. Thank you. I think that takes us back to the rest of our agenda, and the next item was a Medicaid unwinding update.
Mr. Chairman, thank you very much, and also extend my appreciation to the board for their thoughtful discussion about our budget going forward. As the chair of the finance committee indicated, last year we had a series of budget meetings throughout the year. Well, we'll continue to work with the finance committee and the board, find out, how do we become more efficient and effective in executing our operating budget. Thank you very much for the thoughtful and also your support for the budget. And I also want to thank the staff for putting together this budget, reducing our operating budget within increasing operating costs. Thank you very much to the entire staff, in particular Sinisha and his team. Mr. Chairman, I know we have limited amount of time left, so we're gonna go over the unwinding, but we did want to play some of the commercials that the board and the public will start seeing next week about unwinding. So I'm going to ask Ezio to give us a quick update. Ezio?
Yes, sure. Thank you, James, and thank you for the welcome prior. And it's good to be here. I'm going to go through this relatively quickly for the sake of time. The first slide here is to really set the stage for our messaging for this campaign. And some of you might have seen this before, but in case you haven't, is we want to make sure, in summary, that folks going through the unwind don't lose their healthcare coverage. That ties in very well with the message of Access Health, and we want to do it in a way that it doesn't cause any fear and panic, but remind them that they have to take action to get help, to make sure they have health coverage. Next slide, please, Martin. Some key facts on the campaign. It's running in English and in Spanish. It's a campaign that is multi-faceted. It includes TV, radio, print, billboards, transit, digital, social media, and search engine marketing. But while that sounds like a very broad campaign, I can assure you it's very targeted. We're using tactics that are targeted to zip codes that really address the areas these folks live. As James addressed previously, about 30% of this population's mail is getting returned. So this is just one tactic to help get this message out there. We've had our feedback sources on this was DSS. We have shared this with the Health Equity Outreach Consumer Experience Committee, and we've used previous focus group feedback. Where possible, we have co-branded this campaign with DSS. That includes print, TV, and transit. And there's other support for this campaign in market. DSS has its own campaign. We've done a lot of work updating our websites and knowledge bases. The call center is prepared for this. There's live chat available. Tammy very soon will give you a little bit of an update on what we're doing in the community. And we're also supporting this with direct mail, email, and text messaging. And I think everybody is aware we've created a special enrollment period for this. Next slide, please. Here's a little bit of an overview of the campaign. It runs for a year. You can see all the tactics on here. We're using a lot of, like as I mentioned previously, tactics that really target by zip code. That includes TV and radio, newspapers as well. We're including a lot of the ethnic newspapers. And then there's also very broad state to state, which is banner advertising, social media, and search engine marketing. You'll see a gap for open enrollment messaging. We are planning during our open enrollment messaging to also include unwinding messaging in that campaign. So while this campaign might be paused, that messaging will continue through during open enrollment. Next slide, please. I like to quickly play the TV spots that are beginning to run next week. It's in English and in Spanish. And Martin, if you don't mind playing that.
If you're enrolled in Medicaid, also known as Husky, you may need to take action to find out if you still qualify. Access Health CT is here to help. Visit accesshealthct.com and update your information. Once you do that, you can be notified about your eligibility status. If you do not qualify, we can help you find coverage and possibly financial help. This is important. Take action today to stay covered tomorrow. Get started at accesshealthct.com.
Next slide. And this is the Spanish version.
Si está inscrito en Medicaid, también conocido como Husky, es posible que tenga que averiguar si todavía califica. Access Health CT está aquí para ayudarle. Visite accesshealthct.com y actualice su información. Una vez que lo haga, le informaremos si es elegible. En caso de que no sea elegible, Access Health CT puede ayudarle a obtener cobertura e incluso recibir ayuda financiera. Esto es importante. Tome medidas hoy para seguir cubierto mañana. Comience en accesshealthct.com.
Also, the audio for that is what you'll hear for radio. Just to make a note of that, and that is beginning next week, starting the 26th. Here are some sample print ads in English and in Spanish. Some of our online ads. And some of our transit and out of home. And I'll pause there if there's any questions.
Thank you, Ezio. Appreciate that.
You're welcome. Thank you.
Tammy?
Yes.
Oh, Tammy, yeah,
Hi.
please.
All right, great. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. A lot going on with outreach as we continue to ramp up our efforts to support the Medicaid unwind. First, we've set up monthly calls for our community partners, keeping us connected. This is in addition to the quarterly in-person meetings that we hold for our community partners. And so far, it's been extremely helpful getting our partners together, getting feedback from them, and helping us make improvements on our end, which is very important, ultimately making the enrollment process smoother for our customers. We also have our monthly Healthy Chat presentations that we do for consumers, helping them learn about the enrollment options they have, where to find help, and where to find help on the website or in the communities that they're from. We also give them an opportunity to ask questions, so it's very informative and interactive for them. And finally, we have our outreach specialists that are in the field. They're rotating to our Navigator locations, as well as some community health centers to assist their consumers as they visit those locations. And in addition to the staff at different locations, we have three enrollment fairs planned for this month. 2 happened last week. And the fairs are really important for the folks that need help after hours or on the weekends. And in some cases, we do fair hours during the day, depending on the request that we get from that location. They may have a heavy traffic flow at a certain time, so we'll go in and do the fair at that time. So we'll be tracking attendance and enrollments so that we can plan strategically for next month. As you all know, this is the first time we're going through Medicaid on, so we have to get feedback and plan strategically as we move forward. But everything is going well on that front. We're really trying to reach people from all angles. And so far, the feedback has been great from the community organizations and partners that we've been working with and building those connections with. I'll pause if there's any questions. Can move on to the next slide.
Mr. Chairman, very quickly, I just want to connect this to the $2.7 million that the board approved back in April. This is what we're doing with that money, and we are tracking the money we spend, and we are reporting that to the board every month. What we do with unwind, the enrollment numbers, as well as the drawdown from that $2.7 million. But this is all part of that. Thank you.
Thank you. Right. Thank you very much. Thanks, James.
Thank you very much. Moving on to the Broker Academy, I'll give a quick update. Year 2 has been very successful so far. We accepted 53 students this year. And like last year, we met with them a month prior to the actual class training, getting them familiar with Access Health, introducing them to brokers and the instructors, really working hard to keep them engaged and comfortable for the long class week. As you all know, this group of students come from varying background. Some have not been to school in decades. So really, we had to do the work up front to get them prepared for class. Phase 2 was the 5-day training class compared to 3 days last year. We had 2 locations this year. Again, we went back to Gateway Community College in New Haven and Capital Community College in Hartford. We had some attrition. We had 40 students attend the class week, split evenly between each location. And we brought Kaplan training back for year 2. They are a state-approved training course for life and health insurance. And I'm happy to report that all the students passed their class exam, which is a prerequisite to then sit for the state exam. And at the end of the class, we helped all the students set up accounts and provided them with vouchers so that they can book their state exam before leaving class. And we did that because last year it was quite a hurdle for us tracking the students and getting them to actually book the exam. So this was a very great year for us. The students were extremely motivated, and getting them booked before they left for class is really important. We'll continue to have touch point calls with them, keeping them engaged so they can study together, ask any questions they need from us, and see what they need from us. And the goal is to have all of the students licensed by the end of next month, so they can be prepared for the mentorship portion of the program, which will begin in August. Right now, we're going through the RFP process to get mentors for the program, and that will be finalized soon. So more to come on that. Really looking forward to all the students finishing out strong. And I just wanted to thank you all for your support, for all of your support for us standing up the Broker Academy. This program has really been making a huge impact on the students' lives, but also the making a difference in the communities that they're from. And I'll pause here if you have any questions.
Just a comment to say thank you, Tammy, and this continues to be a wonderful initiative. I look at that as, among other things, 40 new jobs in Connecticut, which
Absolutely.
is a fantastic outcome. Ted Doolittle.
Yeah, just a request. Thanks so much for that update, Tammy. A request that perhaps at a future board meeting, we could have some follow-up information about how the first class is doing in terms of their actual ability to enter the marketplace. Thanks.
Absolutely.
Thank you, Tammy. James?
Mr. Chairman, very quickly, we thought that as we indicated this last week, it was our first Connecticut Small Business Summit, and our biggest one of the concerns that we had coming out of COVID, we saw that some of the small businesses that are insured through Access Health, and when we engaged with them, they were pretty clear with us that they were struggling coming out of, they needed help and guidance and coming out of the COVID 3-year period. So we thought that this bringing them together along with resources that could help them pull out of guide them out of the COVID haze that they were in. So that was the genesis for the Connecticut Small Business Summit. And I want to thank John and his team for putting an amazing event for the small businesses. John's going to give you a brief look at how it went through. John?
Thanks, James. Appreciate it. Good morning, everybody. My name is John Carbone. I'm the Director of Small Group, Broker Support, and Product Development. Over the past 3 years, Connecticut small business has taken a major hit on their finances and their employee retention. During the pandemic, Access Health Small Business chose to reinvent ourselves during this time to help small businesses understand the new programs and that were developed under the American Rescue Act. Examples, PPP loans, we pointed them in the right direction to SBAs, helped them out with banks, helped them look at their current small business plans on and off exchange, regardless of where they were. If they were a client of ours, we helped them find the best resources. And that includes if the individual side wasn't a better resource for them. And a lot of them chose that at that moment and continue to do that also. Connecticut small businesses make up 99.4% of all the Connecticut businesses and employ 48.2% of all the Connecticut small businesses. That just shows you how critical and important small businesses are to the success of our state. Access Health is here to serve as a resource and provide support however we can. And because of this, we felt it was necessary to be able to help small businesses get in front of all the necessary resources they need to get back on their feet. On June 13th at the Sheridan Hartford South Hotel, Access Health and Metro Hartford Alliance partnered up to deliver our first Connecticut small business. On this day, our focus was to help small business owners, entrepreneurs, and employees. Our goal is to offer everyone an array of opportunities to discuss current trends and challenges small business face daily, and most importantly, a way to address them. We had over 250 businesses attend. We had an additional 140 businesses on our waiting list. We had over 25 vendor tables throughout the floor, and we were very excited to have a blend of privately owned businesses and state of Connecticut resources for these businesses. At this time, I want to take this opportunity to thank Steve Hernandez for being our MC for the entire day. Steve did an incredible job, and we thank you again. Also, we had several guest speakers throughout the day. Governor Lamont provided our Connecticut Business Summit opening remarks, followed by Lieutenant Governor Bysewicz, Connecticut State Comptroller Sean Scanlon, and the Commissioner of Department of Administrative Service, Michelle Gilman. Senator Lesser also provided some additional comments to our small business owners during lunch. We were also very proud to be able to have our very successful entrepreneur that has invested in our Connecticut community. Gina Larreri, founder and CEO of the Statement Group. You may know her as the owner of the Place to Be in Raw. She was our keynote speaker. She delivered a very passionate and informal speech, and we were very proud to have her there as a resource. She stayed after the event for like 3 hours and probably took about 100 pictures with everybody. So we want to thank her for that time and helping out in any shape, way, or form. Also, throughout the day, we had 4 breakout sessions. Each breakout session had 4 to 5 topic experts on them. These breakout sessions ran about 40 to 45 minutes long. Example, breakout session 1 was about understanding the number, balance sheet management for small businesses. Breakout session 2 was walking the walk, talking the talk, marketing and community impact. Breakout session 3, don't leave any money on the table, tax credit grants and government programs. And breakout session number 4 was taking care of business and employees' health and wellness. So at this time, I want to say thank you to the entire Mints and Hope team, which was our vendor partner for helping us set up this event, and the entire Access Health staff that participated and helped us on this day and managing this event. We couldn't have done it without you. And thank you, James, also for providing us the inspiration and the ability to move forward with this event. We do have some takeaways also too. We are in the process of recording. We did record the entire session and the entire day and all the breakout sessions. We're in the process of editing all those videos, and we will share it with the staff. Then on top of that, we are kind of going through a survey right now. Individuals that participated on the panels and in the event, we're going through that survey process. We're also going to set up a lessons learned And yes, we are going to start planning for next year. So we're really excited about that. So again, thanks for the opportunity and we truly appreciate it. And thank you for everybody who participated. Any
Thanks for the
comment?
update. Great event. Thanks. Thank you for the update. James, terrific work. I'm conscious of the time. We will be losing directors quickly if we don't sort of wrap this up. So I appreciate there's a little more on the agenda, but I think we need to figure out how to move this to a conclusion.
Mr. Chairman, the others just updates, so they don't require any action. So if we want to suspend with the meeting now, we can, and we could update the board with the audit update at the next meeting in September.
I would suggest that because I think we'll lose a quorum.
Okay.
So
Yes,
with
that
that, James, any closing comments?
No, just my continuous thanks and appreciation to the board for their continued support for everything that we do, specifically today for the support for the FY 2024 budget. Thank you very much.
And I absolutely echo those thanks. Thank you to all of you for your work today, leading up to this point.
Yeah, a few minutes.
Motion to adjourn by Doolittle.
Thank you. A second motion to adjourn. Second.
Second by Claudio.
Thank you, Claudio. Any discussion? If not, Charlie Klippel, yes.
Paul Philpott. Mr. Philpott.
Yes.
Thank you. Claudio Gualtieri.
Yes.
Deidre Gifford. Grant Ritter.
Yes.
Steve Hernandez. Andrea Barton Reeves. Theodore Doolittle.
Yes.
CC Woods. Thomas McNeil. And Matthew Brackman.
Yes.
Thank you so much.
Thank you again.
Thanks, everyone. Bye-bye.
Appreciate your time.
Thank you, everyone. Bye-bye.
Bye-bye.